This is me, Dr. Arvind Paikrao, Professor and HOD, Department of Kriya Sharir, Index Ayurvedic College Hospital and Research Center Indore. Today we are going to talk about the intestine. Intestine, in that there will be two things it will be appear. One is a small intestine and second one is a large intestine. So we'll see the first small intestine. In that, what we'll observe that small intestine, it is a part of gastrointestinal tract. It extends from the pyloric sphincter of stomach to the ileocecal wall, and which will be eventually open into the large intestine. So in that, what are the why it is called as small? Because of it has a small diameter than the large intestine, and that is the reason it is called as a small intestine. But it has a long length of around 6 meter long. Small intestine is very much long, like that. It has a 6 meter in length. Then what is the important function of this small intestine? It has a very important function, that is absorption of whatever the intestinal food content or digested food content. It will be absorbed much more in the small intestine. What are the parts of this one? It has three parts. One is duodenum, which is proximal one. Then second one is jejunum, which is middle part of this intestine, and last one is ileum. It is a distal part of the small intestine. Actually, this small intestine we have studied before, like that. It is made up of four layer, inner to outward. First one is mucous membrane layer. Second one is submucosal layer. Third one is muscular layer, and fourth one is serosa or adventitia, layer of the adventitia, like that. It will be having a four layer. So in that four layer, we have already studied it before in first class. So next I will make my face off, and will it means better understand it. So in that we'll see one by one. Special feature of inner layer, that is mucosal layer, is very much important. Mucous membrane of this small intestine, which will have a certain projection, or which will have minute projections, which are known as villi. The height of villi is 1 mm, and diameter is around or less than 1 mm. Villi are, it means, lined by columnar cell, and which are known as enterocyte. Enterocyte, again, there will have certain hair-like projections, and that are known as microvilli. So villi and microvilli are there. These are the special features of this small intestine. And villi and microvilli, they will, it means, increase the surface area which is required for the absorption, as small intestine will have major function of absorption. This will be, it means, this job it will be done by villi and microvilli, and it again, this villi also will have many folds, and this again increases the surface area of this for the absorption. Then we'll see the, it means, in each villus there is one central channels, it will be there, that is known as lactile. Lactile, it will open into the lymphatic vessel. It has also blood vessels also, it will be there. We'll see the lactiles, how it will be appear here in this diagram. We'll see, take a brush from here, and this color we'll see. So this one will take this. Okay, So this is the lacti here, you will find there, and that if you make it somewhat large, there will be, this is a lactile actually. It has these features, and because of that we understand this lactile is very much important, and it will open into the lymphatics near around blood vessels also we'll see. And this is a mucosal layer, and villi are there, and which is made up of lined by the columnar epithelial cell, which is known as enterocyte. This is the mucosal layer. This is the special features of this one. Next we'll see the glands. What are the glands are there? There intestinal glands are there that are commonly known as the crypts of Langerhans. These are the actually tubular gland, and these glands are lined by epithelial cells, and this epithelial cell will have means it will undergo the division of mitosis, which will be having a very faster rate. Reason behind it, that older cell it will be pushed away, and it will be, it means shed off, and with their secretion into the small intestine like that, and because of that newly that older cells will be replaced by the newer one, and that is the reason it has a faster mitosis division. Then we'll see the next I already told enterocyte, it will be slog off along with their secretion in the small intestine. Then we'll see the intestinal gland. What are the types? Its types. There are three types of intestinal gland. One is argentaphine cells, which is also known as enteropromaphine cells, which secrete intrinsic factor for Castle, which is very much important for absorption of B12 vitamin. Then next it is goblet cell. Goblet cell secrete the mucus, and third one penis cell, which secrete the cytokine along with certain cytokine, defensin and this cathelicidin like that. So that is the reason it has somewhat defense mechanism role. So in that defensin it will be secrete more like that cytokine. Then Burner gland, it is a special features of the small intestine. Burner gland somewhat deeply rooted in submucosal layer like that. It is found in first part of duodenum, and which secrete mucus along with certain enzyme also it secrete. The special features of small intestine, that is a Burner gland, that we'll find here. We'll see this gland how they, what are the different cells, and that we'll see what are the, means somewhat histological part here. So we'll see these are the villi. One cell over there, absorptive cell, that is columnar cells. How villi, microvilli are appear over here, this one over the this enterocyte, which is known as this one columnar cells. Next one is goblet cell. Goblet cell, it is here, you will find this one. So about this one, goblet cell secrete mucus. Then next cell, it is enteroendocrine cells. This is will secrete certain hormone like that. This one, that secretin and cholecystokinin. Then penis cell. Penis cell is here. We'll find like that. That will secrete cytokines, which will have defense mechanism like phagocytosis and all. So this is the special features of this three glands which is present in the intestine. Then we'll see the properties and function of succus intricus. Succus intricus, it is secretion of small intestine, and it has volume of 1800 ml per day. Reaction, it will be alkaline because of having pH of 8.3. What are the composition? Major it will have water and solid part. 99.5% it will be water and solid it will have 0.5%. In that organic substance we'll see better in that enzymes, particularly proteolytic enzymes. These are peptidases, aminopeptidases, dipeptidases, tripeptidases. These are the work of the proteins. Then amylolytic enzymes, sucrase, maltase, lactase, dextrinase, trihalase. This will work over the carbohydrate, that digestion of carbohydrate. Then lipolytic enzyme, they will have some, it means digestion over the lipids. We'll see one by functions of the small intestine. In function of small intestine, first one, mechanical function, it is very much important because the small intestine will have certain movement, or because of having this movement they will have mixing or mechanical activity to mix the intestinal content with the enzymes like succus entericus, pancreatic juices and bile. This that will, it is very much required to mix it well with these enzymes. Then next is secretory function. Small intestine, it secrete certain secretions like that, succus entericus along with enterokinase and certain GI hormones it will secretes. Then next it is hormonal function. Small intestine secretes secretin and cholecystokinin. This will have very much important role over the regulation of movement of GI tract, and this also act over the, it means whatever the secretion. So it act over the activities of small intestine and pancreatic secretion also. Then we'll see absorptive function. Absorptive function is very much important in that because of having villi and microvilli, they will increase the surface area, and certainly it will be enhance the absorptive activity of small intestine. Certain foodstuffs are being absorbed from the small intestine. Protein, carbohydrate, fats, other nutrients, vitamin, mineral, water are mostly absorbed from the small intestine. Small intestine, how this absorbed element it will be transported? It will be transported to the lactee. It will cross the mucosa, enter into the bloodstream through lymphatics. In that way, it is being absorbed. Then we'll see the absorption water, minerals and vitamins. Sodium, it is being absorbed along with the glucose, amino acid and certain other substances with co-transport. It means glucose and amino acid it will be absorbed in one direction along with glucose and amino acid. Sodium is also being absorbed. So next it is chloride. Chloride it will be, it means exchanged with the bicarbonate. It is we can say it will be it means bidirectional, like that. It will be exchange glucose. It will be exchanged with the bicarbonate, chlorine, like that, and in that way it is absorbed. Then in the sense bicarbonate it will be enter into the intestine and chloride it will be taken into the bloodstream. Next it is calcium. Calcium is mostly absorbed from the upper part of this intestine. Next we'll see the water. Absorption of water, it is very much important. How it depend on the osmotic pressure. So the osmotic pressure of plasma and the osmotic pressure of the intestine, water is absorbed until and unless the pressure in between two it is equal. Up to that level water is being absorbed. This is very much important, that osmotic pressure will decide the absorption of water. Osmotic pressure of the plasma, if falls down, then then it is being absorbed till the pressure, osmotic pressure equal to the intestinal pressure of, like that, plasma and intestinal osmotic pressure. So next it is absorption of vitamin. All vitamins being absorbed in upper part of the small intestine, and particularly B12 vitamin is being absorbed in ileum. MCQ may appear like that. There will be special absorption of B12 vitamin in ileum, it is found. So absorption of water and water soluble vitamins, it will be easier or faster than the fat soluble vitamins. So in that way absorption it will be taken place. Next we will see the succus intricus. Succus intricus, in that first one in digestive role. In that digestive role we will see the proteolytic enzyme. We have seen peptidases that digest peptide into the amino acid. Next is amylolytic enzyme, lactase, sucrase, maltase, that will convert disaccharide into the monosaccharide, like that. So it means digestion of the carbohydrate occur by amylolytic activities. Next is lipolytic enzyme, that is intestinal lipase. It will act over the triglyceride and convert them into the fatty acids. Next it is a protective function. It has a two protective function, like that. One is secretion of mucus, that will, it means help to make the intestinal level alkaline, and it certainly it also prevent over the ulcer also. Ulcer it will be prevented by the mucous membrane. Then defensive, secreted by penicillin. It is an antimicrobial peptide, which is also known as natural peptide antibiotics, which will act over the phagocytosed bacteria and kill them. This is a very much important role of defensin. Then we'll see the activator function. Enterokinase present in the intestinal juices. It activates trypsinogen into trypsin, and trypsin is very much important for the digestion of protein. So next it is hemopoietic function. Intrinsic factor for Castle. It is secreted in the small intestine, and it certainly help over the absorption of B12, and B12 vitamin, it is very much needed for the maturation of RBC, and it is certainly having this erythropoiesis function. Next, hydrolytic function. Hydrolytic function, it is a digestive function, and succus intricus, it will help in all for the digestion. Next we will see the regulation of secretion of succus intricus. All small intestine secretion is regulated by two ways. One is nervous regulation, and second one is hormonal regulation. In nervous regulation, we understand that sympathetic and parasympathetic activity, it will be there. Parasympathetic activity work over the vasodilation and increases the secretion of succus intricus. In opposite way, sympathetic, it will causes vasoconstriction and decrease the secretion. But it is said in modern science, this how it occur, this is uncertain. However, the local reflexes play a very important role in secretion, like that. Chyme if enter into the small intestine, it will stimulate the tactile stimuli or the irritation that causes development of nervous reflexes and stimulate the gland which secrete in intestine. Then hormonal regulation, a similar way, and chyme, it will be enter into the intestine. Then it secrete enterokinin, secretin, cholecystokinin, which promote secretion of gland by stimulating them. Then we will see the applied physiology of this. We have come to it means end of this one. So we will see the applied physiology of this one. In that there is a malabsorption. It will be there. In that malabsorption, we can understand there is a no proper absorption activity. It will be happen. Because of it will hamper it means certain diseases or certain kind of causes that will hamper over the small intestine, and the absorption, it is a very much important role of the small intestine, and it will be being it means hampered this absorptive role. Then next it is malabsorption syndrome. In that particularly three things we are looking, 3-4 things like that. One is Cohen disease, second one is tropical spur, third one is steatorrhea and celiac disease. These are the malabsorptive syndromes or malabsorption syndrome. Cohen disease, which correlate with the IBD, intestinal bowel syndrome, like that. In that also there is a malabsorption. Tropical spur, this is somewhat inflammatory condition of this intestine. In that, because of inflammation, there is a hamper over the absorption. Then next is steatorrhea. Steatorrhea, in that there is a certain enzymes, it will be not appear for particularly the hampering secretion of lipase. That lipase which will digest the fat, and because of that the fat, it will be not digested, it appear in the urine, in the stool, and because of this one fishy smell, it will be found with the stool. Then celiac disease. Celiac disease is similar to tropical spur, but we can say it is also inflammatory, and here it is also mentioned like that, non-tropical spur celiac disease, which will certainly hamper over this one. So in that way, will it means say this one. I will go up like that. Next it is large intestine. Large intestine, it extends from ileocecal wall up to the anus. It has 7 parts: cecum with appendix, ascending colon, transfer colon, descending colon, sigmoid colon or pelvic colon, rectum and anal canal. So will physiology point of view, we'll see these are the 4 layer, which is we have already mentioned like that. Serous layer is outward and mucous layer is inner one. So we'll see outward to inner like that. Serous layer, it is formed by peritoneum. Mucosal layer or mucosal layer, muscular layer is second layer, which has large intestine has a very special role of this muscular layer. It is made up of 2 layer. One is longitudinal muscular layer, and inner one is circular smooth muscle layer. So the longitudinal layer, it is run over the entire large intestine, and it is typically arranged like that. It will make 3 bands, and these bands are known as tinea coli. The length of this tinea coli is smaller than the total length of the large intestine, and because of that, this large intestine fall into the pouches, series of pouches. We can see small bag like, it means they will appear, and these pouches are known as hostra. This is a very much important feature of large intestine, that longitudinal layer. It will make like it will arranged over the entire length of this large intestine in three band or ribbon like things that are named as tinea coli. Length of this one it will be smaller than the total length of the large intestine, and that's why it made this large intestine into the pouches, series of pouches that are known as the haustra. Next one is submucous layer. It is not well developed in this large intestine. After that, last one, mucus layer. Mucus layer is similar to the small intestine, but there will be, it means there will be no villi. Villi it will be absent in that, and crypts of Langerhans are there. Mucus secreting gland also it will be there, and villi are absent. This is it means difference than the small intestine. Secretion we will see. The large intestine it will secrete like that 99.5% water, and solid content it will be 0.5%. In that pH it will be 8, which is alkaline, and major it means why it is alkaline, because the concentration of bicarbonate it will be high in the large intestine. So we'll see here the haustra, how this occur, haustration. This is the special features of this large intestine. See this, these are the tinea coli. Tinea coli here you will find, and here in the center. And tinea coli it will be run over the entire length of this intestine. Ribbon-like structure it will be appear, and the length of this tinea coli it will be less or the smaller than the total length of large intestine. Because of that, this it will be fall into pouches, and these pouches are known as haustra or haustration. It will be appear in the large intestine. This is special features of this large intestine. In that way we are at means understanding this one. So next we'll see functions of large intestine. First one is neutralization of acid. There will be, it means lot of bacteria it will be there in large intestine that will produce very high amount of acid. For it means neutralize it, there will be secretion of a large quantity of bicarbonate, and this acid is being neutralized. Then next is a lubrication. Mucin it is secreted, and goblet cell it will secrete mucin, and because of that it lubricate the intestinal bowel content, and there will be that facilitate the movement of the intestine, and content it will be thrown, it will be transported in downward direction. As we all know, there will be vata anuloman in Ayurvedic point of view if you look over this function. Then we'll see the functions of large intestine, in that absorption function. Large intestine will have, it means that much absorption it will not there as compared to the small intestine, but water, electrolyte, organic substances like glucose, alcohol is being absorbed here, along with anesthetic agent, sedative and steroid also absorbed in the large intestine. Next one is formation of fecus. How the fecus is formed? All the water it will be being absorbed in the large intestine. Particularly in large intestine, water is being absorbed much more amount, along with all the nutrients and certain other substance also it will be absorbed, and unwanted substance it will be thrown into the large intestine. Because of that, water is being absorbed more, so all the solid content it will be appear, and that will be excreted, or it is the feces amount. Next, we will see the functions of large intestine, that excretory function. Along with the stool, there will be heavy metal, lead, bismuth, and arsenic also it thrown down into the feces. So this excretory function. Next, it is secretory function. Mucin and organic substance like chloride and bicarbonate, it is being secreted in the large intestine. So next it is a synthetic function. In the synthetic function, we understand there is a intestinal flora that will, it means, synthesize bacterial flora of large intestine, synthesize folic acid, vitamin B12, vitamin K. This is very much important, and we understand folic acid and B12 have erythropoietic activity, and vitamin K, it will have role over the blood clotting. Next we will see the applied physiology. Applied physiology of large intestine, it will be there. We understand there will be diarrhea, constipation, then appendicitis, ulcerative colitis, like that. Diarrhea, we this is somewhat, it means motion, or it means loose motion. Frequency of loose motion, it will be more than 2-3 frequent per day, like that, or 8 up to how much it diarrhea, it is loose motion. Then constipation, it is very much important. Constipation is one of the symptoms which can causes for all entire diseases, like that. It is a symptom found in many diseases like diabetes and all. So this is very much important. Constipation, in the sense there is a defecation in it is what we can say, like that. That will be having a dry stool, and because of that there will be means a person, it will not go or having discomfort with the defecation, and daily there is a frequency also hamper, like that. It will stool, it will be passed in two days once, like that, or 3 days once, or difficulty in passing motion also. This will appear in constipation. Next, it is appendicitis. One organ, it is their appendix. There is an inflammation of this appendix. It will be appear in the appendix inflammation, appendicitis. Itis, it is used for the inflammation of the appendix. Then ulcerative colitis. Colitis is we can say ulcer, it is found in many area of the intestine, in peptic, in gastric, peptic ulcer, like that. In small intestine, there also it will be ulcer, we can find out, and large intestine also. IBD, it is a particular disease, it will be occur. So all these diseases, applied physiology, we can learn in pathology in next year. So we'll stop here. So thank you for it, means.